Yeah, I got a couple of lights set up down there and just make sure the best keep green and personal line stuff things and you can cover the that. We should be turning that around with us every time. If that's what you're doing. Yeah. If you're gonna walk around with it, they're just try to hold them from the base. That's the trick.
Okay. Good morning, everyone. Halloween should be a break. Here to help. My name is Tom Soroka. I'm at a meeting in New York, the broker advisor. Thanks, fella. For the city of Binghamton. I oversee a lot of the plan administration and selection and work for the city's active employees as well as retirees. This is D. Hill from AETNA. And you may know Chuck Robinson as city controller. Sandy Schnurbush as well as in that office in finance and benefits. If you have issues, problems, questions with anything we talk about, who do you call? Not Ghostbusters. Sandy or me. Really call me. She's gonna send you to me. In my team. Have you ever tried to call the insurance company? Not that much fun. Call us. You know who to call, you know what to ask, you know how to help you. That's what we do. In addition to the advice and counsel, we want to help you with your issues, problems, and questions. We go through a very serious process every year of trying to make sure we have the best plans for the best rates available to you and your family. You know the names. Excellus, Blue Cross Blue Shield.
Did you turn?
He did.
Yeah, and stay closer.
Okay. Sorry. Excellus, Blue Cross Blue Shield, MVP, Humana, United Healthcare, you've heard them all. We look at each one of these plans every year to make sure that what you're getting is the best plan for the best rate. In 2024, the Biden administration passed what was the Inflation Reduction Act. Everybody remember that? Part of that act was to help retirees with Medicare coverage. Prior to 24, the maximum annual cost out of pocket for retirees on pharmacy was $8,000 per year. Right? That was the law. $8,000 per person per year was your out of pocket. That's what you had to pay for prescription drugs. The Inflation Reduction Act lowered that from $8,000 to $2,000. So today, in 2025, your maximum out of pocket is $2,000. Going to be indexed, I think, by $100 on the new plan, so $2,126. That's a significant difference in out-of-pocket maximum to you and your family. But I guess you can know what happens next. What does that do to the premium cost of your plan? I can tell you that the county's plan went from $250 per person to over $500 as a result. Now, in addition to all that, there are a number of trends. Pharmacy is a big deal and the biggest area of growth in healthcare spend in the country. We're seeing pharmacy do tremendous things for people. It's helping them live longer, stay out of hospitals, control conditions. That's all good stuff. You've heard the names Wegovy, Jardians. Watch the television, right? Every other advertisement is about prescription drugs. Ask your doctor if you're a candidate. The average cost for Wegovy monthly is $1,200 per month. And you can imagine when I sit with controllers and people trying to make budgetary decisions, I look at all the different claims data that's coming from employees and families. 10, 15 years ago, the top 25 claims would be 3, maybe 4 medications. Now it's 12, 13 out of 25. So we're seeing tremendous growth in the areas of prescription drugs, and they're doing great things. But when it's $1,200 per person per month, these numbers add up pretty quick. Okay. Dee's here to help us understand how to use your plan. We want to make certain that you're getting everything you're paying for when it comes to these plans, and they've evolved tremendously. They're now offering all kinds of very cool resources and tools. I'm not going to take the details from her, but I can tell you, if you're not taking advantage of the websites that they have, the apps that they have, the libraries of resources and tools that are available to you, that's where it's going. Right? Wellness is a big deal. This is where all the carriers are going. If we can make people healthier, we could probably slow down the use of healthcare, right? Theoretically. So if we can help you be healthier for you and your family, maybe we save a little money too. Okay? This is your time to ask questions. This is your time to understand how this works. So don't be afraid. We're here to answer your questions and help you. Thanks.
Good morning. I'm going to sit here for just a minute and I've got a short presentation for you. I'm sure many of you have been on the plan for a little bit, so you've seen some of this information before. I know that there may be some newer folks going on, so we're going to flip through this pretty quickly to get to the meat of what Tom was talking about, the additional benefits that are available to you folks that we want to be sure you are using. Okay, so first of all, you know, they always ask why Aetna? What do we offer that they can't get somewhere else? First of all, me. I have been with the company 25 years. I started when I was 2. I started this job as a temp position 25 years ago. I was coming in to do some simple work while I found something better. And then I learned about what we did. And I fell in love with the company. I believe in what we do. I truly believe that you as retirees need an advocate, not only on your side of things, not only with the city and with Tom, but somebody at Aetna who truly wants to do what's best for you and help you as much as they can. And that's why I'm here. And that's why, again, after 25 years, a 6-month temporary job turned into a career. And there's lots of information that talks about, you know, we've been doing this for 172 years. Aetna wrote its first Medicare check in 1966. We've got more than 1 million members. But again, the important part is you have people on your team that are truly here to help you and to do what's best for you. You know that you can reach out to Tom if you've got questions, if you've got issues, and the moment you do, Tom calls me.
True.
He does. He really does. He's on, I think I'm on his speed dial.
That's good.
Now, is there anyone here that is newer to Medicare that you haven't been on it for a few years? A couple? Okay. So Medicare is broken down. You always hear about Medicare Part A and Part B. And over the last few years, you've really, you hear about Part D. So Medicare Part A is your hospital coverage. That is your inpatient stay benefit. And you know that there is a flat deductible on traditional Medicare for your Part A anytime you're admitted to the hospital. Part B is your physician's charges. That's your lab work, your doctor's visits, x-rays, physical therapy. Part D is your drug plan. And Part C is what you have through the city. That are the Medicare Advantage plans. So under Part C, we bundle everything else up under that. So it's all in one place. Now you can rely on just traditional Part A and Part B. There is a Part B deductible for all of your medical care every year. Medicare pays on average about 80% for all of your services, but there's no out-of-pocket maximum. So heaven forbid there is some kind of major accident or illness, there's no cap to what you pay during the year. So what is Medicare Advantage? We are required by law to cover everything that Medicare does. So every benefit that Medicare covers, the Medicare Advantage plan does as well. But on top of that, again, there's an out-of-pocket limit, so you're not going to continue to pay all year long. There's also the additional benefits that are involved, and we're going to talk more in depth about those later. And you also have a medical staff to help you if you have a chronic health condition, if you have diabetes, if you have COPD, if you have CHF. You have a team of doctors and nurses that will help you navigate that through the insurance. They can help you find the best care for you. They work hand in hand with your personal doctors to make sure you are getting everything you need to take care of you. Now, you know, with your plan, you can see any doctor you want to, as long as they accept Medicare, they're willing to treat you, and they're willing to bill Aetna. Now, I know that there's a lot of conversations going on, providers that go in and out of network. You do not have to use a network doctor. You truly can use anyone that will see you, that accepts Medicare, and that's going to bill Aetna. This is a unique plan. You don't see a lot of these. It's a very rich benefit, and it gives you a lot more opportunities.
So Dee, if I can add something. Anybody who's been on the plan for 10 years or longer, you may remember that you used to have to come back to town to see your doctors. It had to be that Excelis or individual network that you had to come back and see. It's no longer the case. Anywhere in the country that accepts Medicare, you can see. There's no primary care physician referrals. You show your card, you get care. Okay? It's very flexible.
Correct. And you don't need to get any kind of authorizations. If you are out traveling, if you're, down in Florida, if you're out in California, it doesn't matter. You can call us. We'll help you find a network doctor there. And you don't need to get any kind of okay through us to see anyone else. There is also coverage if you're traveling internationally. Now you cannot go to Mexico and get a tummy tuck. But if you are down on the beach and you step on a jellyfish, you can get care there and we will reimburse you stateside. They don't negotiate with Medicare, so you will have to pay in advance for services, but you file a claim when you return and we will reimburse you for that.
So emergency services anywhere in the world is covered as in-network,
Correct.
right? Now, as she stated, they don't know anything about your health plan. You might have to put out a credit card in Portugal, pay the bill, get all the receipts, get all the documentation, bring it back, and then we'll submit it for you to get reimbursed.
And again, if you are out and something like that happens, reach out to Tom when you get back. He and I will work together to get those claims submitted and make sure that you are reimbursed. Now, if you are out traveling and you need help finding a provider, this 800-267-2637, that number, you can reach out to them and they will help you find a provider wherever you are. Now, we did just talk about, Tom said, you don't need to select a PCP, and that's correct. You don't have to have a PCP. You don't need to get referrals. We do suggest that you have a primary care doctor to help make sure that you have someone that is aware of everything that's going on in your healthcare journey. We know that as we age, we tend to have different healthcare issues that require different specialists. With a primary care doctor, they help you keep all of that in one place. So again, it's not required, just recommended. I'm not sure what's happening with the slides here. That's interesting. Bear with me, folks. I'm sorry. There we go. So here's your benefit. I know that hand out your the basic benefit sheet that lists everything. These are the standard benefits that most folks look at. Now you will receive a document in the mail if you have not received it already. It's the annual notice of change. That out any change happened to your from 25 into 26. Now, as Tom mentioned, the only benefit that did actually change was that out-of-pocket maximum on your pharmacy. It went from 2,000 to 2,100. All of the rest of your benefits have remained the same.
Notice though, folks, there is no deductible on your plan. Everybody aware of that? This is a straight copay arrangement. Get care, pay the copay, go home.
And all of those copays, all of your copay for your doctor's visit, for your hospital, that all applies to that $750 out.
Yeah. $750 is your annual regardless, and it's all combined to get to that number.
So on the drug program for the new folks. It is going out, it's not just me.
No,
Okay.
it's not.
I tend to kill technology, just so you're aware. So Medicare prescription drug plans as a whole, across the board, regardless of who you get it from, whether it's Aetna, United, Cigna, the Blues, they're all built the same. There are 3 tiers. You have your deductible phase. On your plan, you do not have a deductible for your prescription coverage. There's no deductible. You go straight into your copays. Those copays are in what they call your initial coverage limit. Once your copays equal $2,100, you reach what they call the catastrophic tier, and your prescriptions for the rest of the year will be covered at 100%. So again, it's $2,100. That's the cumulative of all of your prescription copays throughout the year.
Now, is that my out-of-pocket based on the copays, or is that the value of the prescriptions?
So there is some unique Medicare math that happens in the background. And when Medicare figures it, they look at what their standard Medicare's behind the scenes standard pharmacy benefit is. And they take, and I apologize, it's kind of hard to explain without a diagram and a whiteboard to write it all out. But they figure the cost is what 25% of the negotiated rate for that drug is. They apply that 25% to your out-of-pocket maximum, even if your copay is only $10. So that drug may be $1,000. You pay $10, but they're going to apply $250 to your out-of-pocket maximum. It's very unique Medicare math. I know it doesn't make a lot of sense. I've been doing this a long time. It doesn't make sense to me all the time either, but they do that to help you meet that out-of-pocket faster. So even though, again, if you had a $10 copay, but 25% of the negotiated rate of that drug is $250, that's what they apply to your out-of-pocket maximum.
That's a big deal. That's a big difference. That doesn't mean your out-of-pocket is actually $2,100 out of your account, right? You might only be paying $100 towards the 2,100. I'll give you some examples. Eliquis is a blood thinner many of us are on. What's that cost retail? It's about $600 a month. Aetna pays, you pay 10 or 20 or, whatever your copay is. 25% of 600 is what is applied to your out of pocket. Okay,
So you don't always see that, but your explanation of benefits that you get every month on your pharmacy will show that, you paid this much, but this much was actually applied.
heck of a deal.
Now, we have a huge network of pharmacies. There are more than 63,000. There's more than 14,000 preferred pharmacies. On your pharmacy benefit, on your tier 1 drugs, if you use a preferred as opposed to a standard pharmacy, it does save you $1 at the time of sale. And I know that $1 doesn't seem like a whole lot, but those dollars do add up quickly, especially when you're getting prescription drugs. You are not required to use a preferred pharmacy. You can use standard. The preferred, again, just saves you a little bit of money.
I'll tell you this too, there are a lot of retailers out there, you owe it to yourself, do some shopping on different pharmacies and what they charge you for a specific medication. Take a common medication that you're taking, call 3 or 4 pharmacies, ask them what they would charge. In many cases, if you're taking generics, a lot of these retailers, especially the Targets, Walmarts, these guys they're giving them to you because they want you to come in, buy tires, right? And groceries. So they're giving them away. Be aware of that. In addition, if you're on a maintenance medication, what's a maintenance medication? Blood pressure, cholesterol, acid reflux, right? Mail order medications are available to you. They come right to your home every 90 days and you're going to pay less money, right?
Correct.
You owe it to yourself to save you and your family money by looking at mail order medications rather than going down to the pharmacy every 30 days, waiting in line and getting your prescription. Right? Yes.
I have a question. The Aetna will only start to me once I turn 55. So I'm going to start Medicare. And
Okay.
and their deductible is like $1,000. So I'm going to be paying everything for 2 months, and then I get on the Aetna. So you won't allow me to get on the Aetna 2 months prior to my birthday month?
No, ma'am, you have to be eligible for Medicare to be on a Medicare Advantage plan. Uh-huh. So January 1st, your Medicare primary, your Medicare, then you should be, can we talk after this and find out exactly why? I'm not sure where the disconnect is, but if you're Medicare eligible January 1st, then you should be eligible for the plan January 1st, unless there's something behind the scenes, Tom, that I'm not aware of, but we'll absolutely talk. Yeah, but if you're eligible for Medicare, you're eligible for the plan regardless of how old you are. But yes, please, don't leave without talking to me. Okay. This website up on the board, I'm not sure if y'all could see it from there. It's AETNAretireeplans.com. You can find a wealth of information out on that website. You can look up providers. You can look up find all of your doctors, all of your pharmacies, information about the plan. If you are tech savvy and you're not like me, you don't kill technology on the regular basis, there's a wealth of information available to you out on that site. And I know that Tom just talked about just a little bit ago about the mail order pharmacies. This is personally what I use because I don't want to go stand in the pharmacy line because it's getting, with the shortage of pharmacists and the waits, it's ridiculous. Mail order pharmacy will ship it to you. You can set it up that it does it automatically every 90 days. Comes directly to your home. If you are taking medications that require a special packaging, if it needs to be kept cold, they do pack it appropriately. So you know that what you get is safe. They do track it and it's really pretty quick in then getting it out to you.
Talk a minute about annual immunizations like flu shots or shingles or any of these immunizations.
Yes, so all of your routine immunizations, you can get those at your pharmacy. They are covered, even though you get them at the pharmacy, they're covered under your Part B benefits. So what would be your medical benefits? They're covered at 100%. So all you need to do, you can get them from your regular primary care doctor during your routine visits. You can get them through the pharmacy. Just show them your Aetna ID card and they will bill us. Be mindful, you will see shot clinics set up at your VFW or your Legion or the senior center. Be mindful of those. Check with them to make sure that if it's something that they are doing as a community service and they're giving those to you at no cost. If they try to get your insurance information, call us first, call Tom, let us check it out. You will often, I say often, you will sometimes see organizations that go out to do these shot clinics that you end up being charged for because they do not bill the insurance companies. But you can go to your local Walgreens, CVS, your primary care doctor, get your flu shots, your pneumonia vaccines, the shingle shot, which if you have not gotten, I highly recommend because that is the most painful thing ever. But yeah, get your preventative vaccinations. So we were talking about the pharmacy benefits. On that tier 1, if you go to a preferred pharmacy, your tier 1 generic drugs are $9. If you go to a standard, it's $10. So it is only $1, but again, those dollars do add up. Another thing I want to point out is your insulin. You will never pay more than $35 for a 1-month supply of your insulin, regardless of what tier it falls in. So whether it's a tier 1 insulin or a tier 3, you will never pay more than $35 for that. Now, if you need additional help with your prescription drugs for paying for them, I would like you to take down this number. There's a group called Benelink that you can reach out to. They will ask you some questions and they will determine whether or not you are eligible for this additional assistance. Please know that neither Aetna nor the city will know if you are denied. They don't know why. We don't have any information on this. We can't give you any more information other than their phone number. They make that determination on their own, but I try to get this out to as many folks as possible. If you need that additional assistance, give them a call. Reach out to Benelink, reach out to Social Security. They will make out those determinations. They'll notify you and then they'll notify Aetna. So if you are eligible, it can drop your co-pays for your prescriptions drugs down to $2 or $0 depending. But yes, please, if you need additional help, please give them a call. And I'm actually going to skip these slides because I want to talk about the actual programs. So this is one of the programs you have available to you, and the rest of these are going to be all about those additional benefits. This is Resources for Living. Resources for Living is a program that will help you find something you need. So if you need to get your gutters repaired, They will help you find somebody who is licensed and bonded in your area to repair your gutters. Now you do have to pay for them to fix your gutters. I can only do so much, but we will help you find them. We will make sure that you have somebody that is trusted, and there's no cost to you for that. And this works for any number of things. If you're like me and you are a crocheter or a fiber artist and you want a group to hang out with, they will find somebody in your area. If you are looking for military support groups, they will help you find people. Pretty much anything you can look for, they will help you. I will tell you, I didn't believe that they did as much as they said they did. So I reached out and asked them to help me find a way to find a particular brand of pea soup that we used to have when I was a kid. And I will be darned if they did not find a company that would ship it to me. So random things they can find for you. And this is all they do, are help you find things, something that you need, they will help you find. You also have access to the 24-hour nurse line. Now, this is a program that if you are at home and just you're not feeling right and you're wondering whether or not you should maybe go see the doctor, you can give them a call and tell them, these are my symptoms. This is what's going on. And they can tell you, oh, I think you're probably this, or it might just be that. You don't need to go to the doctor. Or they're going to tell you to pack it up, call 911 and go. They will also help you if you've got questions about where to inject your insulin. Or if you're on something like the Wegovy or the Ozempics, where to inject those. You realize that you've missed a dose of medication. You can call them and say, you know what, I didn't take my morning meds. Should I take them now or should I wait? It's not intended for emergency care. It's not intended for urgent care. Please don't call them if you think you're having a heart attack. But if you've got a funny rash on your arm and you've been out gardening, you can reach out to them and they will help you kind of direct you to what your next best action might be.
So D, has anybody used telemedicine yet?
Oh, we're getting there.
Anybody? Or this isn't the same?
It's not the same.
Forgive me. Is there a reason to register first
For this,
for any of these?
not for these.
Okay.
This is just, the 24-hour nurse line is just a simple, like we could call them now and say, I've got these weird bumps on my foot. I was out walking barefoot on the beach. What do you think?
Yeah. Okay.
But
That's good stuff.
they're for non-emergent, just kind of random questions that may come up. Do you think I should call my doctor for that kind of thing?
Sure.
We have the AETNA Compassionate Care Program, and this is to help not only you, but your family members, caregivers, those end-of-life decisions. They're hard. I know, I've been through it. I lost my mom, my dad, my stepmom, and my grandmother all within 13 months. This program, we had access to it and it's amazing. They help you if you are a caregiver and you need respite care. You need somebody to come help stay with your parents for a couple of hours so you can go to the grocery store. They offer a lot of grief services, suggestions, tips, things to help you in making those decisions. We know that there is nothing harder than watching a loved one move on to the next plane. And this program helps to make it a little easier. Now, here's the telehealth that Tom was alluding to. You're going to see two things here. You'll see telehealth and you'll see teledoc. Now, telehealth are virtual office visits with your particular doctors, your primary care doctor, your rheumatologist. These are virtual visits with your doctor. And there's no additional charge for that. You just have your regular copays. There's nothing additional to have virtual visits. If you are thinking that, there's something going on, but I don't want to drive to the office. If you're worried, it's winter time, you don't want to get out and drive in the snow. You can arrange televisits so that you can still have your doctor's visits. It's just all done virtually. The next one is Teladoc. Teladoc is different in that you call and schedule a visit, but it's with a licensed doctor in your state. It's not going to necessarily be your doctor. If you have, you wake up one morning and you've got a horrible sore throat and a headache, you can call Teladoc. They will set up a virtual visit for you. They will call you on your cell phone. You will have the doctor right there. I could tell you that they will tell you to, open your mouth and say, and hold your phone there so they can look. But these are virtual visits with licensed doctors in the state of New York or wherever you happen to be. This is another one of those benefits that if you are traveling to Florida and something happens, they will get a doctor in Florida to treat you through Teladoc. So this is a great program. We use this a lot. I know that like my son uses it. He's in college. College kids do dumb things. Teladoc is a great program. You do have to register ahead of time. They'll ask you some medical questions and then that doctor will call you.
My experience is within 15 minutes.
It's usually very, very quick.
That's
Yeah.
pretty good. It works.
If you're sitting around and you're like, you know what, I've got nothing going on this afternoon. There's nothing on TV. Go in and register for Teladoc. Put your medical information, put your medicines in there. It's not going to cost you anything to do that. And it's there if you need it. This is one of my favorite benefits that they offer. You have access to non-emergency medical transportation services. You get 24 one-way trips up to 60 miles every year. If you have a doctor's appointment, if you're going to the optometrist, you need to get your eyes dilated. You can't drive after that. You're not supposed to drive after that. You can use this service to take you back and forth to those. If you need to get to a doctor, but your spouse can't get there until later, you can use one of those one-way trips, go to the doctor, have your appointment, and then come home with your spouse. They say one-way visits for just that reason. You can have round trip visits, but they put it as one way so that if you are in a situation where you just need somebody to pick you up or drop you off, you have those visits. On the plus side with this one, if you go to the doctor and he tells you, hey, I need you to go pick up this medication at the pharmacy, this service will take you to the pharmacy, wait for you, and bring you home, and it will not charge you an additional trip. It's all going to be included in that one trip. These do need to be scheduled at least 2 days in advance. You can call member services and they will help you get those set up. I'm sorry? No, ma'am, 60-mile limit.
Is it true also, Dee, that there are pharmacies that will deliver to your home?
Yes. CVS does. I know that for sure. But again, if you go to the doctor and he puts you on a new medication and tells you to go get that now, and you have these rides set up, they will take you, do that, and then take you home, and it's not going to be an additional charge. You also have the post-discharge meal program. If you are hospitalized, now you do have to be inpatient, so you have to actually be admitted into the hospital. It doesn't, a 23-hour observation does not qualify. You do have to actually do all of those reams of admission paperwork. But once you are done, they will provide you with 14 days of meals post-discharge. The meals are only for the patient, so we can't have, meals delivered for, husband and wife. It's just the patient. They are delivered, they're fresh meals, they're not frozen. I sat in on a board maybe 6 months ago with the vendor to look at the meals and what they planned. And they will accommodate just about anything. If you need a vegetarian meal, if you need a Muslim meal, if you are vegan, they will accommodate for all of that. So they will provide you any kind of a meal that you need. And again, they're fresh, not frozen. They are delivered to your home, and it's 14 days worth of meals.
Take somebody to the emergency room. And it's, check it right all the emergency room. And, they decide to keep the individual. They keep them overnight. And they, that's the inpatient then?
Well, that depends, because sometimes they'll keep you overnight and it's just what they call a 23-hour observation. They have to actually admit you.
You're in a floor, and you go.
Well, again, it depends. It depends on the hospital. Sometimes the hospitals will put you up in a room, but they have to actually do that admissions paperwork. So sometimes they'll keep you in what they call just an observation status. They don't actually admit you, but they'll stick you in a room in a bed, but just keep you, overnight to watch you. They don't actually admit you. So you do have to, they have to actually admit you.
To keep the 75.
To waive the 75. So if you're admitted, they do waive that 75, but if they just keep you under observation, then you would still have to pay that copay.
If they admit me though, they waive the 75, but because I've been admitted, now it's gonna cost me $250 for a hospital stay.
Correct. And that doesn't matter whether you're there. Oh, sorry, gosh, that got really loud. Whether you're there 1 day, whether you're there 30 days, whether you're 300 days, it's the $250 copay,
But they waive the 75.
but they waive the 75.
That all
Yeah,
goes
that-
towards your 750
that-
Correct.
out of pocket for the year.
That's just answer the question.
Okay. And the silver sneakers, we get asked about this on the regular. With silver sneakers, they will pay for a gym membership. The real perk to this one is there's not a limit to how many gyms you can join. So if you go to 24-hour fitness because you like their weight room, you can have that. If you like going to the Y because they've got a great pool, you can have that too. So there's no limit on the number of gyms that you can join.
How does the network work on that, Dee? Is there a network that they have to work with?
There is, you would contact Silver Sneakers. They will give you all of the gyms that they contract with in your area. And they do everything behind the scenes for you. We don't have access to their information, unfortunately. But they will tell you all of the gyms in your area that participate. I know that Gold's Gym does in a lot of areas. I know that Planet Fitness does in a lot of areas. I know 24-hour Fitness does in a lot of areas. So yeah, you would just reach out to Silver Sneakers. They will register you. They'll give you your ID number, and you just go into the gym, show them your card, and they get you set up.
Sandy, is there anything to add?
I'm
Okay.
almost done. Okay. Actually, I am done. This is just a slide on the member website. I don't know if any of you use that. There is a lot of information out there. You can see your claim information. You can see your prescription information. You can track any pre-authorizations. If you are having a procedure done that requires a pre-authorization, you have access to all of that information. You can also see and print temporary ID cards from that information, from that website. It gives you access to all of that information for looking up your providers as well. There is an app in addition to that you can use, but there's a wealth of information that's available to you out there. We will often have healthcare videos, special programs that you'll see out there. They do circuits of celebrity chefs that come on and do healthy meals, exercise programs, all of that kind of information out there. And that's it, Miss Sandy. So I'm going to open it up now for questions. Yes, sir.
Observation question. 23 hours of observation. When you go into the emergency room at, let's say, 9 o'clock at night, and they say, oh, we have to keep you for observation. They move you out of the emergency room, send you into the hospital, you get a bed. 23-hour limit?
No,
Because
it's just what they happen
23
to
hours would
call
be
it.
8 o'clock the next day. They're not going to admit you. They're going to keep you another night.
Yeah, that's just what they tend to call it, is 23-hour observation. The medical field kind of needs a name for everything.
Okay.
But yeah, so you actually have to be admitted. So it's one of those situations where they have to, you go through all of that planning, you do all that paperwork with the staff.
It's up to each individual hospital. They determine when they're going to admit you or
Yes,
leave
sir.
you in the emergency observation.
Yes, sir.
Okay.
I would just say with a recent experience that you ask. Am I being admitted? Because a doctor will sometimes say the word admitted, but then when the registration people get there, they use the word observation.
Mhm.
And so just, if you're not sure, just ask, am I being admitted to the people that come to have you sign all the consent forms?
Yeah.
Or am I going into observation? That's what I've found is the best.
Correct.
That's a great point. Yep. Folks, you're the patient. Don't be afraid to ask questions. I know many of us, for whatever reason, don't necessarily want to ask questions to your doctor. You're paying the bill. You're the patient. Have a relationship with your doctor. Ask questions. Nothing wrong with that.
No,
And-
advocate for yourself.
No question.
Advocate for yourself. Yes, ma'am.
Wait,
Card, that pre-authorization, like a PET scan.
Mhm.
How do you do pre-authorization for a PET scan?
Your doctor does it.
So they do it to the Medicare,
They do it to Aetna.
they do it to Aetna, not Medicare.
Correct.
Okay, thank you.
We do. Medicare has us do all of their heavy lifting. We do all of the paperwork for Medicare. They just kind of sit back and wave at you as you go by. So we do everything for them as far as your care. Any other questions?
Let me just make another final point. These healthcare facilities are getting larger and larger. You're seeing consolidation of the healthcare industry. Lourdes now has got. Forgive me. Lourdes is now Guthrie, right? That's happening all over the country. You have access to a tremendous amount of resources. And have you used the app eGuthrie yet? Have you used the UHS app? You know what is my chart? Have you seen that? This is amazing information, incredible information. And every doctor that you see now has access to this. Because one of the problems that Dee was talking about is your cardiologist reads you and gives you this medication. Your endocrinologist sees you and gives you this medication. Years ago, that was a problem, possibly. Interactions are a big deal. So it's really cool, the information that's available to you and your families with all of these pieces of information and resources available. it's incredible to me how these things have evolved. The services they're providing as compared to your active employee plans, which are also tremendous, by the way, as compared to what I see in the public, what I see out on the street with private employers. Your active plan is tremendous. Now we get to go into transitioning into Aetna with a nice Medicare plan with tremendous amount of services and resources. Be your advocate though. Ask questions, find out information. It's to your benefit. And if you need us, call us.
Yeah, please reach out to Tom. And he will absolutely get me.
We'll give you a card.
Well, what I did was I also brought down the magnets,
I think I'm gonna give you a card.
which I've sent as well to people to you have the claims and the benefits concierge.
Oh, perfect.
service.
Let's use
That
that.
has both of them on there. I sent them out last year in packets. But I brought more down because we have so many.
Sure.
Well,
This is cool, Sandy.
My question is about first time people are just signing up for the Medicare.
Yes, sir. Yes, sir. Yeah, I don't, because Medicare won't talk to me when it comes to you. Everything, well, you can actually, you reach out to your local social security office. And you can go in there and you'll sit down with them, but you can do it online. I promise I walked my sister through it. It's very easy. Yeah.
This question is for Sam. I heard something about wait till you're 65 years old. They're paying. No. Supplemental. The supplemental.
I'm not sure. Sorry. Help me out. So if you're actively employed and over 65, you can maintain the coverage under your active plan. But if you're retired, you're pushed to the Aetna plan and you're 65. Okay, you can stay on the active plan to your 66 if you're active. Whatever your employer plan is, that's what you can maintain until you retire.
if you're an active employee, there is supplemental dental and vision coverage. Buy-up coverage if you choose to have that as an active employee. But as a retiree, there is the Aetna coverage because of the Medicare and how it goes together.
That help? Help me out. What can I help you?
So the plan that we're all on is the supplemental for the city, correct?
Well, are you
Wait,
asking?
can you clarify active or retiree?
So if you're, sorry, Sandy,
Go ahead.
No. I think what you're saying is you don't have to come on this plan. You don't.
Right.
Nobody's forced to go on anything.
But this is
You
our
can stay.
supplemental that we pay for.
You can stay on,
At a reduced rate.
well, you can stay on Medicare A and B and find your own Medicare plans, no problem. Or you can have access to this plan. But if you leave this plan, you can only come back once. You with me?
And this plan is at a rate.
Yeah, you're getting a 30% of total premium versus going out and paying Part B, paying, whatever your supplemental plan is on your own.
So there was no reduction if you waited 66. It's the same as if it was 65.
No reduction. So if I'm active, I stay on the plan until I'm retired. Once I retire, I have access to Medicare. Everybody pays the same rate. Until you retire. Or older. I mean, you have people who stay here till they're 68, 69, 70. Okay. Yes, sir.
I think use the word supplemental
there are two plans. There's a supplemental plan and there's an advantage plan. They're two separate things. We're on an advantage plan. Where, if I'm not mistaken, make it simple. Aetna manages our health care. Supplemental, you pay a higher premium. And you get different coverage. Something like if you went to AARP, you get supplemental.
Right. That's individual.
That's the difference.
That's individual coverage on your own, which you're free to search and find any service that you can find outside of this. But you're not going to get the employer-employee formula. Right? You're pretty much on your own. At that.
Yeah, I think that's sometimes the confusion is because you get a lot of different things and hear a lot of different words. Basically what
Well, they just-
you're carrying through the city is what other people call the Advantage Plan. Ours has a different name, but that's basically what it's doing is giving you the additional Part D with other coverages that align with your Medicare A and B. Okay? If you go outside to other organizations, including if you get an Aetna flyer that doesn't say City of Binghamton on it, because even Aetna mails mass mailings out at this time of year for anybody who's on
Yeah.
Medicare. But if it doesn't come from the city, if it doesn't reference the city, then you should call us. You should call NFP to make sure, because what we find is that people see that supplemental insurance and they think, oh, I'm going to get an addition to the city's coverage, and they join, but it was just a play on words. And then I get a notice from Aetna telling me that you canceled your coverage and went to a different plan, which means you dropped the city's coverage. So then I have to reach out to you to make sure, did you really intend on doing that? And most people didn't realize what just happened. And so they didn't want to leave the city plan. And so now we have to try and get you back on right away so that you don't use your one time. Or some of you came back on because you didn't, take it when you first left. And so you don't have a one time back in. So we're trying to get you back on within the same time frame, knowing it was an error. So all I can say is if you see the word supplemental, if you even see an Advantage Plan, and it is from Aetna or anyone who's trying to tell you, you should call if you're in question, because we'll help you to make sure that the step you want to take is the step you're going to take. And if you do, that's fine. I mean, we understand. But a lot of people, because the words are used interchangeably sometimes in the insurance industry, supplemental and advantage. And so people believe they're getting something in addition to the city, and often you can't get it because it will break what needs to be with the Aetna contract.
Yeah.
And so then you can't have it. You have to give up one.
To add to what you're saying, Medicare will not allow you to have two Medicare Advantage plans or two Medicare Part D plans. You can only have one. And they will, if you buy into Joe Namath's commercial on TV and you buy into that plan, it'll kick you out of the city's plan. Medicare will come to us and say, hey, Bob decided he didn't like y'all anymore. He went with Joe, so you need to cancel his coverage. And we can't override that. You would have to go back to the city and tell them this was a mistake. We didn't want to do this. So any of those flyers you get, whether it's from Aetna's individual market, and I apologize, I don't work on that side of the world, so I really don't have a lot of information on the individual plans. Just don't do it. Because I tell you, in all of my years here, I've never seen a plan as rich as what the city offers you. And I'm not blowing smoke. I'm not, because, I work for the city. I never have seen a plan this rich. You have a fantastic plan through the city. Don't let anybody tell you any different. Correct.
Yeah, your plan.
You do not. If you are still actively employed and you have coverage through the city, you don't, there's no need to. And there's no penalty if you don't. There's no benefit to enrolling in Part B. If you're still actively employed, you 100% can. Part A is automatic.
Yeah.
It's, you don't sign up for Part A. Part A, if you've worked 40 quarters in your lifetime, Medicare automatically enrolls you in Part A. You don't need to do anything for Part A. You don't need to do anything until you are ready to retire. So, whatever you do. Uh-huh. Okay. So once you're getting to that and you're like, okay, I'm done. I want to go fish. 3 months before you decide you want to retire. So if you're going to retire in June, 3 months before. Yeah. So
I think
give yourself, when you know that you're on the short end of the stick, give that 3-month time period, enroll in your Medicare Part B. Right now, no, not till you're ready to
You-
retire.
you just need to know that you're gonna continue to get paperwork and emails if you have one from the government to sign up.
Yeah.
And then when you do retire, they're gonna give you an additional form typically that we have to fill out so that you don't get fined for not taking it. So just so you
Yep.
can expect those things to happen. We see them all the time. People bring them into us, we fill them out, usually while they're standing there so that you can take it back to Medicare, things like that. But you will get an additional form for us as your employer to fill out. Otherwise, you can face a fine for not enrolling when you should have.
Yep.
That's how they say it.
That's, yep. No,
No,
As
many
long as
people
you're
do because of the free of the Part A. So they
Yeah.
figure it's free, why not sign up for it?
Yeah.
And then the overlap is there if needed, but you don't have to. But many people do because they've been paying in, so they want to get it out through the A at least when they have to.
Yeah.
That's fine.
because don't pay those Part B premiums if you don't have to.
This Part B in the county, you paying? About 200? 185? Don't pay Part B until you have to.
Yeah.
I know there's probably 3 or 4 different unions here, but the dental supplement, when you're a current employee to sign up for that supplement, I didn't do that. And when I retired, went to the dentist and really didn't have much dental coverage except basic food. Didn't have that in. So we ended up calling Teamsters and got the supplemental dental insurance through Teamsters, but maybe people that are still working sign up for the supplemental dental insurance like through the Teamsters currently, right now, and then you'll have it, right?
I don't know anything about the Teamsters coverages because I don't get that information from Teamsters. We only get what they send us,
But if
which
you're-
is the
if you're
medical.
previously signed up, like current employee,
Mhm.
you have the supplemental dental insurance.
We do have the supplemental. You can't carry that into retirement. You can pay Cobra for it, for the 18 months for the 102, but the city does not offer a dental or vision plan for retirees. Yeah, we've looked into it. Yeah, we've looked into it. I didn't know that Teamsters even had an over 65 supplemental dental that they carried. They've never shared that with us. So, and there's nothing in the contract that says it's there. So none of the paperwork that comes from them. Yeah, that's good.
There's a supplemental dental inclusion fire. So I'm sure there's other unions that will.
It's outside of the city, so it's not part, it's part of your union. It's not part of city insurance. And that's what we were told, last time when we had, a presenter, that so many people pay for the monthly insurance, but the benefit that you might get out of it, you would be better off taking your premium and putting it into a savings account and using it when it came time to go to the dentist, because there's often not as big of an impact in a dental bill with the insurance. Obviously, it depends on the coverage. We've looked several times into dental coverage for our seniors, but and retirees, but the number of people that have to enroll is very large in order for us to see, even remotely see, a plan that's worth the dollars that you would be investing monthly.
I'll add quickly to that. I can tell you dental insurance, not only in upstate New York, but throughout the country, is getting more and more difficult. And what I mean by that is fewer and fewer dentists are willing to participate with any of the insurance carriers that provide dental insurance to you, your families, or employees of the city. And it's not just this group. This is nationwide. I think of dental, though, as kind of like a Christmas club. Nobody dies from it. Nobody spends $1 million. You get $1,000 a year to spend, right? What's the average person nationally spend on dental services per year? How much? About $500 annually. What's the monthly premium typically for individuals for dental insurance? $500 a year. Isn't that amazing, right? Dental insurance is basically paying a premium that is pooled and that you get to use throughout the plan year. That's kind of how it works. It's nice to be able to have a premium so that you're not paying all $500 all at once. But that's kind of how it works. So we're always willing to try to help people with it, but it's not magic. It's a Christmas club for dental services, frankly.
Well, we just want to thank you for coming. We'll be around if you have some additional individual questions we can answer for a
Thank
few minutes.
Thank you, Sandy. Thank you,
So,
D Hill.
Thank you
For
for
coming.
them for
pleasure.
coming.
And truly, if you need anything, I know it sounds like a line, but I really am your advocate. This is what I do. I do it for a reason. So anything you need, let Tom know, let Sandy know. They have, direct access to me. Okay. Thanks, everyone.
I'm going to stick around for 15 minutes.